welcome to this episode of the Caring Project podcast series. I'm here today with Danielle. Hi Danielle.
Hello.
We've got Tracy.
Hi.
And we've got Gun.
Hello.
Hi, and we're, as some of you may know if you've already listened to some of our podcasts in this series, we're exploring what we found in a big research project about carer mental health. In a moment I'll ask Gun to just recap what that project's all about, and then what we'll do is get down to talking about some of the results. In this podcast we're going to talk about what we found around the following themes. So we found a theme on impact of caring responsibilities, the quality of relationships and finances, and the association all of those themes had with care and mental health is what we're going to discuss today. So Gun, over to you. Can you tell us a little bit about the project and what all the aims and objectives and things were?
Yeah, sure. So the background to the project here is that we know that family members and friends play a really important role in supporting people who are nearing the end of life, you know, both in terms of practical or emotional support and personal care and so on. But we also know that these carers, as we call them for short, do suffer quite a lot of impact on their own mental health from this caregiving. By that we mean it has an impact on their anxiety, depression, distress and quality of life in particular.
Right.
So what we were trying to do with this project was to identify the factors that make carers' mental health worse or better during end-of-life caregiving. And we did this by gathering all the known research evidence on the factors or things that affected carers' mental health during end-of-life caregiving, and trying to summarize that in ways that made sense to stakeholders such as carers themselves, health and social care practitioners, policymakers, commissioners and so on, so that they could then use that information to try to see how they could improve carers' mental health during caregiving.
I think that's one of the really important things about this project, isn't it? We don't just want to sit on a dusty shelf, we actually want to get this information out there. So if you're listening to this now and you're one of our stakeholder groups, a GP, healthcare practitioner, a policymaker, commissioner, and you've got a friend who you think might be interested, please pass on the link, because this information hopefully can be really useful, so we do want to get it out there. So as I said, in this episode we're going to talk about 3 different themes that we found. Tracy, maybe can you tell us just a little bit about what are these themes, where have they come from, why have we got themes in this project?
Yeah, so in terms of the research evidence that Gunnar just mentioned, what we looked at was evidence of carers' experiences and their stories really about what helps their mental health and what affects their mental health. And from looking at all that information about their stories, we found there was particular themes that came up that were really important, that were linked to carers' mental health. And so these 3 themes are what really we've found in the evidence of what affects carers' mental health. Either protects their mental health or actually worsens it. Yeah,
so there were 7 themes overall.
There were 7,
So, and we're going to talk about them all in different episodes from this series. So I think if we talk about the first one that we've got on our list today, we've got impact of caring responsibilities. And I mean, so let's just break that down. What exactly does impact of caring responsibilities mean? It's probably fairly straightforward, but just for clarity.
Yeah, well, basically it relates to how carers' mental health is affected by their caring responsibilities. So things like carers' workload, their life changes in caring for the patient.
Okay, that makes sense. So what exactly did you find? Was there a lot of evidence for this, or was the evidence that you could find quite clear? What was the effects?
Well, we had a reasonable amount of information about how life changes affected carers. So overall, negative changes to carers' lives from caregiving were related to worse mental health for them. So that is, if they were able to do less of the activities they wanted to do, have less time for themselves, less time with other family, impact on work and so on. All of those negative impacts we would see were related to their mental health. And it was also things like if they had caregiving tasks that were difficult, or they had to spend a lot of time on caregiving tasks. Again, that would be related to increased anxiety, depression, worse quality of life, and so on. And then also there were some studies that looked more closely at the burden.
Okay, what are we thinking about with burden? That's a bit of a technical term in some respects.
It is, and again, it's sort of quite a wide concept, but it's about how it affects carers in a range of respects. For instance, again, about not having enough time for themselves, being stressed about caregiving, being angry about caregiving, or having a relationship with other family members affected, having an impact on their health, not having as much privacy, for instance, that they would like. So it's kind of these burden measures trying to sort of tap into all of those kind of more challenging impacts from caregiving.
And it goes beyond, it sounds like, just sheer workload as well. They talk about some emotional factors that get involved under that umbrella term of burden.
Exactly.
And so what did you find out about burden and mental health?
There was a very clear relationship between the level of burden that caregiver felt and then in turn the negative impact that this had on their mental health. And that's kind of how it affected them overall, and the demands and how demanding they felt caring to be.
Yeah, absolutely. I suppose if you feel something very demanding, you automatically start to feel a little bit under pressure, don't you? So, and if it's a long period of time, because we talk about end of life care, but I don't think we've really, in any of the podcasts that we've recorded so far, I don't think we've specified that. I think some people think end of life is maybe your last few weeks, but what we mean by end of life is just you're not being treated to be cured anymore. So end of life and palliative care can go on for years, can't it? And if you're under that burden or that strain or that pressure for a long period of time, you can see how that could really affect somebody's mental health.
Yeah, definitely. And a number of days of caring was shown to have a link to carers' mental health. So obviously the more days that carers were caring for the person, then the more likely they were to be affected in terms of their mental health. So that really sort of what you're saying there really resonates with our findings.
Yeah, that makes a lot of sense. And what about, we talked before about in a different podcast that we recorded about the patient's sleep and sleep disturbances having an impact on mental health. Did we find anything, was there anything about carers' sleep in this literature?
Yeah, it was pretty mixed, to be honest. So there was mixed information really about whether sleep problems or fewer hours of sleep did relate to worse mental health or not. So that wasn't as clear cut really as the burden and the workload.
That's interesting.
I think that's quite a surprising finding, really. You'd sort of expect, to be the relationship. If your carers are getting less sleep, you'd expect their mental health to be poorer.
Yeah, I guess as we're seeing with this, there's lots of other factors that are beyond just one or two things, and they all interlink and play off each other, don't they?
Absolutely,
so, Okay. Was there anything else that we found out about the impact of caring responsibilities?
Well, there's some evidence that it might be tougher for those we could term sandwich carers. That's those people who are kind of caught between still having childcare responsibilities and then possibly in addition looking after an older family member or relative.
So they're caught in the middle.
They're caught in the middle. Hence the sandwich term.
Sure.
Yeah. But that evidence is still a little bit unclear, but you could see exactly how that might be an added stress factor. You kind of pulled in different directions, have double workload.
Definitely, yeah. Okay, I can definitely see that one. So it sounds like overall it's pretty clear that the more burden there is, so that's more complicated tasks, taking more time, having more changes to their own lifestyle and schedule. It sounds like overall that is associated with poorer mental health for our carers.
Yeah.
Right. So there's lots of practical ways there that you can see people might be able to step in and help, whether that's just a friend or another family member of the main caregiver or professional services. There's opportunities there to give some real practical support, isn't there, I think to our carers.
There are ways you can think about how can we reduce this burden and the demands on the carer to give them a bit more breathing space.
Yeah. Great. So moving on, we're going to talk about the other theme that we're talking about today, which is quality of relationships. So again, I don't know, Tracy or Gunnar, Danielle, do you want to tell us what exactly do we mean? Who's involved in these relationships? What do we mean about quality of relationships?
So in a nutshell, relationships really, it relates to how carers' mental health is affected by the quality of their relationship with both the person they're caring for and within the family, so like family dynamics.
So it's a bit more expanded, it's not just the person they're caring for.
Yeah, that's right.
Okay. So what did we find in this theme?
Well,
So,
yeah.
No, I was just going to say there wasn't a lot of evidence about this theme. However, there's a pretty clear picture that there is a link between family dynamics and the quality of the carer-patient relationship and carers' mental health. But it was more limited compared to some of the other themes that we've been talking about.
I suppose it's fair to say that, as you're saying, the evidence seems to be pretty clear, and maybe this is an area that we need to become more aware of, and we need to look more into. But yes, as Tracy's saying, you know, it's the relationship within the family, with other family members, not just the person cared for. So, you know, it looked like where carers felt that the family as a whole was good at coping with stressful things. They had better mental health.
Okay.
But conversely, if the family didn't offer a lot of help and support to each other, then that was a negative. So the sense of sort of cohesion and how supportive you felt the family was important, and it looked as if it led to less burden on the carer, but also improved their mental health.
That makes sense. And was there anything about, I mean, the psychologist didn't be coming out here, I suppose, but was there anything about communication strategies and I mean, it's one thing feeling supported, but was there anything about, you know, actually how they were communicating with their family, how well they worked as a team, I suppose, in that sense, because, you know, teamwork's all about communication. So was there much literature on that? Was there much evidence?
There was a bit of evidence on communication. For instance, if the family weren't so good at expressing their feelings, or if they expressed feelings, it was in terms of a lot of negative emotion. That wasn't good in terms of care mental health. And also coming to the patient-care relationship, it seems to be important that to have good communication between the carer and the patient about the illness. And that helped carers in terms of, you know, their anxiety, depression, and so on. So yes, communication definitely comes into it.
And was there anything else that we found to do with quality of relationships?
Yes, there was some information about carer dissatisfaction with the carer-patient relationship, but this was mixed, to be fair. So in one study we found a negative link, but in another study there wasn't a link.
Yeah. And we often find that in research, don't we, that it can just depend on how a set of questions were asked, or how some data was collected, or just the population, you know, from country to country, or, you know, younger people, older people. You can get these very different findings, even though you think you're asking about something really similar. So I think the other one that I saw that came up under the quality of relationships was, again, I'm drawn to this one because I'm a psychologist, but there was a study, wasn't there a study that you found that looked at attachment styles?
Well, exactly. It's one study found that where the carer had what you might call an insecure or anxious attachment to the patient, that they had poor mental health. By here, that we mean that insecure, anxious, the carer perhaps had feelings of low self-worth and self-esteem, and worries a lot about what other people, like the patient, thinks of them and the things they're doing. So again, that might be another area for exploration.
Yeah, you can see that
to understand better.
That's quite evaluative, isn't it? You sort of constantly seeking feedback and say, am I doing good enough? Am I doing good enough?
Yeah.
And particularly in a context where if there's not great communication between you and the patient, you're not getting that feedback that you're doing a good job. And you're worried, do they think I'm doing a good job? You can really see again how that would feed into somebody if they're feeling anxious or depressed. Okay. So, I mean, we said there wasn't a lot of evidence out there, but I think it's really interesting. It covers a range of issues with regarding relationships. And again, I think it gives us and people who work with carers quite a lot to think about in terms of the family dynamics and how that can affect people. Moving on, the other theme that we wanted to talk about today that we found information about was finances. And interestingly, this doesn't always come up a lot. So, Gunnar, I don't know if you want to say, I think it's obvious what we're talking about when we talk about finances.
Exactly. And this was quite interesting in the project as a whole, because in terms of the research evidence, there wasn't a lot of studies on this. We only found 6 studies out of a total of 64 quantitative studies and 30 odd qualitative studies across a lot of studies. There were only 6 studies that looked at this, but we worked with a carer review advisory panel that advised us on the project, and they highlighted the financial situation as really important. So maybe this is a good example of where actually the researchers have really not focused on something or really studied something which is of great importance to carers.
Yeah, and I think if you want to know more about that, I mean, we're going to discuss a little bit here what the scientific literature and the evidence that's been published as, but we've got a podcast in this series with Jackie, who was one of our review advisory panel members, and she gives a really fantastic account. I mean, it's a great podcast anyway, that one, but she gives a really fantastic account of why finance was so important and how it underpins so many other things. So I think if that's something you're interested in, or it's just worth a listen anyway, frankly. But yeah, I think that really brings it to life why finance is so important in a way that maybe our few facts and findings that are going to come next maybe don't quite give it as much life. But so what did we find from the scientific literature? What did we find in the evidence?
Yeah, so I think of no surprise really, you know, the carers who had financial difficulties, you know, they did have poorer mental health, which, you know, it seems quite obvious, doesn't it, really, when you think about it?
Yeah, it absolutely does. I think everybody feels like that if they're struggling for money, don't they? It's a lot of pressure, a lot of worry straight away. Did level of income have a relationship with care and mental health? So was it that all rich people felt okay about it, or was there something else going on, do we think, with finances?
Well, I think income in and of itself didn't seem to be related to care and mental health. What was important was whether you were struggling, whether you had difficulties, whether you had enough of a budget to cope or not with the situation. And again, that makes sense, doesn't it?
Yeah.
If you have sufficient financial resources to cover what you need, then that's okay. And if you don't, then you're going to be struggling and you're going to be badly affected. You're going to have lots of concerns and worries.
That's it, because even if you've got a lot of money coming in from whatever source, if you've also got an awful lot of money going out, you haven't necessarily got a lot to spare. So you might sound rich if you only look at what's coming in. But if you can't afford it, you fundamentally can't afford it. And that seems to be what this boils down to, isn't it? It's can you afford that support on your own terms, rather than how much money have you got.
And of course, the other side of this situation is if you might have to reduce your work hours or quit your job, because you have to be a carer, and that is really time consuming and demanding. So suddenly the income you used to have might be greatly reduced, or it may be gone.
Yeah, and that can be quite stressful, can't it? Just reducing your outgoings. If you used to say shopping at Waitrose and all of a sudden you have to shop at Iceland, or because your income's plummeted, it takes a while to adjust to that lifestyle change. And at the same time, you're trying to adjust to all these other lifestyle changes. So we talked about burden of caregiving, and maybe your relationships with your family are getting a bit strained or stretched. It's a lot. It's just another thing that you have to try and manage at a time that's probably already quite stressful. Really, there's a lot going on.
Yeah.
And was there anything else in finances, or is that more or less all the take-homes that we've got for that one?
I think that those are the core elements. It's really about. I think in summary, it is what leads to a shortfall. The gap between the outgoings and the incoming finances is the crucial bit.
Okay, great. So we've covered quite a lot of ground there. As we said, these are 3 themes that we've sort of put together in one episode here, because there wasn't an awful lot of literature on any of them, but there's a lot of really clear messages, I think, that come out, and I think it gives real clear inroads and clues as to how, again, anybody listening, so whether it's just that you know somebody who's caring at end of life, or whether you're somebody in a position of actually being able to help in terms of being a healthcare practitioner or a commissioner or something, I think there's some quite obvious ways that you might be able to do something or offer some support or some care, even if it's just asking questions with a carer that you're speaking to. So thank you very much, Gun and Tracy and Danielle, for discussing those 3 themes that we've got today. If anybody wants to hear more information, as I say, we've got some other podcast episodes which we will have links to on our website, and which will hopefully be available to download. We've got lots of other resources and outputs. You can find us on Twitter @CarerProject, and that's got a link out to the website from there. Thank you very much for joining us today, and hopefully we'll speak to you again soon.